Thank you, Mr. Chairman, for your kind introduction. My name is Kenyang Yu, and working for Veterans Health Service Medical Center in Korea. Actually, the Professor Emeritus of Seoul National University, Professor of Epidemiology, as well as the National Cancer Center of Korea. And I used to be the President and Secretary General of the APOCP. First of all, I'd like to give my special thanks to Dr. Siddiqui, the members of the organizing committee, for my invitation. And I'd like to have a talk on the breast cancer screening as in part of the National Cancer Control Strategy in Korea. Recently, the age-standardized mortality in most cancers shows decreasing trend in both sexes in Korea. However, the breast cancer in women shows a significantly increased mortality trend until 2016, followed by the non-significant changes thereafter. The age-standardized incidence rate of breast cancer had increased by 4.3% annually for the last decades. This is a unique epidemiologic feature that has been observed in Asia over past few decades. This shows the most common incidence cancer in Korea in 2019. In men, lung cancer is the most common, followed by stomach, colorectal, prostate, and liver cancer. In women, breast cancer is the most common incidence cancer, followed by thyroid, colorectal, stomach, and lung cancer. On the left side of this slide, you can see the incidence and age standardized the incidence rate of breast cancer in selected Asian countries. And on the right side of this slide, you can see the age incidence curves in selected Asian countries. Countries with higher incidence like Pakistan, Singapore, Philippines shows a Western type age incidence curve of breast cancer, while countries with a moderate occurrence level shows a peak at age around 50 years of age, namely the Asian menopause. If data from Israel is included, the figure becomes more striking. These findings strongly suggest that there must be an upsurge of younger breast cancer cases under age 50 among countries with moderate incidence level. Beginning in the early 1990s, a couple of large-scale multi-center case control studies aimed to identify risk factors for breast cancer in Korea. A fundamental question was whether there are differences in established risk protective factors in Korean women compared to the Western woman. However, among those factors identified in this study, protective effect of breastfeeding against breast cancer was in general more prominent in Asian countries, while the early menarche and the hormone replacement therapy showed very weak association, and the postmenopausal obesity showed a moderate association. In Korea, it is found that the women who are unmarried, nulliparous, who had fewer number of children, who became pregnant at older age, who didn't transfer children, who are obese, who experience early menarche and late menopause, and who has a family history of breast cancer are at higher risk of breast cancer. The identification of risk factors of breast cancer, which are country specific, finally enables us to develop our own prediction model of breast cancer risk assessment. Such a report has been published not only based on the series of a case control study, but also on a long-term prospective cohort study in each country. You can see the report from China, Japan, and Korea. Then what is going to be happen in the future trend in breast cancer statistic in Korea? Many countries in Asia, including Korea, are now experiencing low fertility and aged society. According to the projections, the population in Korea is expected to become top heavy, as shown in this figure. So we expect that more cancer cases will take place in these regions near future. Korea has been experiencing a considerable changes in lifestyle in pattern, including eating habits. For example, grain intake has continuously been declining while there has been a steady rise in meat consumption over the last 4 decades. In addition, dramatic changes in reproductive behaviors, including delayed marriage age, low fertility rate, early menarche, may have the greatest contribution to the breast cancer. If the current trend continues, we can expect incidence breast cancer to rise steadily in the future. However, when compared to the Koreans living in Korea, Korean immigrants have substantially higher incidence levels of breast cancer, which suggests that breast cancer might be increased further in immigrant women due to changes in environmental and lifestyle, including diets at present and in the future. There has been numerous epidemiologic evidence on the possibility of further increase of breast cancer in Korea. Based on the trend in mortality over the last 2 decades, breast cancer mortality in Korea is estimated to increase almost 4 times by 2020 compared with the 1983. There is no doubt that this will surely lead to a great burden for Korean women at large. Then what do we need to do to address the breast cancer burden in Korea? Disease burden is composed of the burden due to premature death and disability. As one of the premature deaths burden, cancer imposed considerable burden on the nation's economy. The estimated total cost caused by cancer in 2005 is supposed to reach 14 billion US dollars, 1.7% of national GDP, and 1.0.7 billion US dollar for breast cancer. In this sense, including cancer burden by promoting national cancer control activity becomes one of the most urgent health issues in Korea. In Korea, the National Cancer Screening Program was introduced based on the first 10-year plan for cancer control. In 2001, Korean National Cancer Center opened, and when the former President Kim Dae-jung attended the National Cancer Center opening ceremony, he ordered the introduction of the National Cancer Screening Program. In 2003, the Cancer Control Act was established, and the development of national cancer screening program was included in the act. We considered these five most common uh, cancers, like stomach, liver, colorectal, breast, and cervix, to be included in the national screening program. And in 2002, the National Cancer Center and experts made the first cancer screening guideline together in order to develop evidence-based national cancer screening program, as you can see in this slide. But in 2015, the guideline was revised. This is the revised version of breast cancer screening guideline. Here, only mammography was recommended for breast cancer screening. In addition to the breast cancer, the guidelines for 7 other cancer types has been made in 2015. 15, right? And the guideline recommends provide breast cancer screening with mammography for women aged 40 to 69 every 2 years. So based on the revised guideline, the protocol of National Cancer Screening Program was also changed. The interval for liver cancer became 6 months since 2016, and the cervical cancer screening has been provided to women aged about 20 years since 2016. And in the 2019, we launched the lung cancer screening. Regarding the breast cancer, clinic breast examination as a screening tool for the breast cancer was deleted in 2016. In Korea, there is a national health insurance service, and most Koreans are eligible for this health insurance service. The government provides medical aid to protect the low-income people. Currently, national health insurance beneficiaries who are within the lower 50% of income status and the medical aid beneficiaries can receive cancer screening for free of charge. The same cancer screening protocol is applied for the remaining 50%. Only 10% of the total cost for the test is charged to these individuals. However, colorectal and the cervical cancer screening are free for those with higher income. This is the schematic process of the National Cancer Screening Program. The Ministry of Health and the Welfare is in charge of the planning and budgeting. At the beginning of each year, a large target population is selected by the National Health Insurance Services. After this selection, invitation letter are sent to people from the National Health Insurance System. The invited people can receive cancer screening in local hospitals or clinics which are certified as screening units. At the screening, the test results are mailing to screened people within 15 days, and hospitals or clinics send bills to the National Health Insurance to claim the fee for the test. Also, the report results into uh, the web-based database claim for free database for the National Health Insurance System. Then National Health Insurance pay for the screening fee to the hospital. like this. The number of participation for breast cancer screening has been increased steadily since 2002. Average rate of participation in the public and the private cancer screening program, including National Cancer Screening Program, stands at 30.8%. And in breast cancer, and 57% in uh, cervical cancer, respectively. Compared with that of the United States, Korea's cancer screening participation rate still remains low relatively. This slide shows performance of the National Cancer Screening Program in 2016. The positive rate and cancer detection rate are vary by cancer type. Sensitivity of the breast cancer screening was 67%, and the specificity of the breast cancer screening was 86%. This slide shows proportion of breast cancer patients by stage by year of first diagnosis and the proportion of patients who were diagnosed at an earlier stage has increased. This data indicates that improvement in survival rate among breast cancer patients may be partly due to early diagnosis at earlier stage of breast cancer by breast cancer screening. As you see in these figures in table, those who underwent screening shows 51% breast cancer mortality reduction compared to subjects who had never been screened. This mortality reduction effect lasted until the age of 69. The survival rate is a key barometer indicating national cancer screening programs' effectiveness. As you can see in this slide, we have a very high 5-year survival rate for uh, cancers of thyroid, breast, uterine cervix, with more than 80%, and the overall 5-year survival rate for breast cancer is currently about 94%, very high. And there are risks and benefits of breast cancer screening. This screening can reduce mortality of breast cancer, increase the use of conservative treatment, and reassure patients when result is negative. However, there can be false negative, and screening can introduce unnecessary investigation in women with false positive results. Overtreatment of patient abnormalities and false reassurance that breast cancer is not present when actually there is a breast cancer. Discomfort associated with procedure, radiation-induced breast cancer, and psychological morbidity. The second term plan for national cancer control aimed at reducing cancer burden significantly through primary, secondary, and tertiary prevention efforts. The primary prevention program currently underway are for strengthening the national prevention campaigns such as smoking cessation, dissemination of cancer prevention guidelines, and providing the target population with mass screening service, strengthening the financial support, and improving the quality of life through quality care for cancer patients are some of the government's secondary and tertiary programs. Also, the government was strengthening capacity building for cancer control by sophisticating the nationwide cancer registry program, investing more in R&D activity, enhancing the public awareness about all aspects of cancer, and nurturing the next generation cancer specialists. The fourth National Cancer Control Plan has been introduced, and this plan has a revision to create a healthy country free from worries of cancer in any area by activation of cancer big data, advancement in cancer prevention and screening, the improvement of cancer treatment and response, and establishment of health equity. The government developed 10 codes of conduct for cancer prevention to help the general public lead a cancer-free life by following preventive guidelines. The codes of uh, conduct include quit smoking, eating sufficient fruits and vegetables, reduce salt intake, not drinking alcohol, and work out regularly, and keep healthy body weight, receive hepatitis B vaccination, and the maintenance of a safe sexual behavior, and avoid occupational cancer risk, among others. The government developed 10 cancer prevention strategies to help a general public lead a cancer-free life by following prevention guidelines. This includes quit smoking, eating sufficient fruits and vegetables, reduce salt intake, not drinking alcohol, work out regularly, keep healthy body weight, receive hepatitis B vaccination, maintain a safe sexual behavior, avoid occupational cancer risk, among others, and undergo a routine screening. In order to increase public awareness about the importance of cancer prevention activity, the National Cancer Control Act designated March 21st as Cancer Prevention Day. The first anniversary was celebrated and included many events to increase knowledge about cancer prevention activity. These, these are pictures taken during the first Cancer Prevention Day. In order to increase public awareness about the importance of cancer prevention activity, various types of exhibition and campaigns having been designed and performed by non-governmental organizations, including Korean Breast Cancer Society and the Korean Breast Cancer Foundation. This picture was taken at Pink Ribbon campaign in Seoul in 2004. The free service of mammography examination is also provided irregularly but continuously for public mammographic screening. Since embarking on an economic development project in the early 1960s, the Korea has achieved an incredible success, and Korea's economy was dramatically transformed from an agricultural country into a highly advanced industrial nation during the relatively short period of time. Korea is now experiencing a rapid aging of the population, mainly due to increased life expectancy. The life expectancy for male is 79 years, and that of a woman is 85 years now. The system of universal healthcare coverage based on the National Health Insurance Program was introduced in 1988 when the Seoul Olympic Games were held. An export driven economic development strategy resulted in per capita gross national income from 87 US dollars in 1962 to almost 30,000 US dollars currently. So many aspects of a woman's health has also changed a lot, but the statement that the breast that has never lactated is more liable to become cancerous, as described by British doctor J.E. Lane Clayton in 1926, would still be true, I believe. Thank you very much for your attention. 감사합니다.